Right, so we have Michael South. He's a 69-year-old male who presented to the ER with a substernal chest pain. He describes it as if he had a car parked in his chest. He said that he reports his pain starting 2 hours ago while he was gardening, and it persisted after rest. He reports that he had chest pain on and off for the past 2 weeks, and he's now nauseous, diaphoretic, and he threw up in the ER. He's had a transient ischemic attack in 2007, and his past medical history is of hypertension, diabetes, AFib, and dyslipidemia. He's currently a smoker. He smokes about a pack a day for the past 40 years, and he reports drinking 2 to 3 beers on the weekends. His father passed away with an MI. Some important lab values are his EKG show AFib with tachycardia, ST elevation in 2, 3, and AVF. Peak T waves, CK-MB levels are at 10.5%. His troponin levels are increased. His glucose is over 225. His INR is 0.9. APTT is low. His LDL levels are really high at 193. Some of his home medications he's taking right now: ginkgo once daily, aspirin 325 daily, simvastatin 40 milligrams daily. He's taking metformin 500 milligrams twice a day. He's still taking diltiazem CD 240 milligrams daily. He's taking a multivitamin daily, and he's also taking loratadine 10 milligrams daily.
After assessing Michael South, it's apparent that he has suffered a STEMI due to ST elevation seen on his EKG, his elevated troponin, and his elevated CK-MB levels. Our recommendation at this point is that we're going to discontinue the ginkgo due to potential risk of bleeding. We're going to discontinue the simvastatin. We're also going to discontinue the use of morphine due to his codeine allergy. Although we can give up to 2 more doses for his pain with nitroglycerin, we're going to discontinue the current dose of aspirin. Some of our acute goals at the moment are to alleviate pain and restore blood flow. So for his PCI, our goal is to direct blood flow to the ischemic muscles within 90 minutes from the first medical contact. So we're going to do a loading dose of ticagrelor, 180 milligrams by mouth once daily. We're going to do a bolus dose of IV Lovenox, dosed at 30 milligrams. Then we're going to do 80 milligrams sub-Q for every 12 hours. We're also going to give him Rayapro as a loading dose. It's going to be 18.5 milligrams IV. Then we're going to dose it at 9.25 micrograms per minute, and we're going to continue that for 12 hours post-MI. We're going to monitor the EKG, his heart rate, and his blood pressure continuously. We're also going to check for any signs or symptoms of bleeding. And we're also going to check his mental status. We're going to monitor some of the cardiac markers such as his CVC, his BNP, his APTT, his PTT, and his urine output on a daily basis. Our maintenance goals at the moment would be secondary prevention. And what we're going to do is we're going to do a dual antiplatelet therapy. So we're going to go with ticagrelor 90 milligrams twice daily for 1 year, plus 81 milligrams of aspirin. That's going to be the max dose for the aspirin. We're also going to start the patient on lisinopril 5 milligrams for his blood pressure. We're going to add a high-intensity statin of Crestor 20 milligrams daily. Our goal LDL is going to be less than 100. We're going to also give him nitrostat 0.4 milligrams sublingual dose. That's going to be used for his chest pain as needed. We're going to also give him Coumadin 5 milligrams daily for his AFib. We don't recommend bridging therapy at the moment just due to the increased risk of bleeding. We're going to have a goal INR between 2 and 3. We're going to monitor that weekly, and then after that, once it's stable, we'll monitor that on a monthly basis. We're also going to continue all his other home medications. We do recommend some lifestyle modifications at this point, such as quitting smoking, better management of his pre-existing conditions, such as his diabetes and his high cholesterol. It would be awesome if Michael South decided to exercise just a little bit, and if he continued to get a yearly flu vaccine. Outside of that, his diet's good, and we recommend that he keeps that up at this moment.